Hypertrophic cardiomyopathy is not a single disease. How to identify higher risk patients for sudden death?
Okay, so hypertrophic cardiomyopathy is a disease associated with sudden death, although at a fairly low rate. What we're trying to do is to develop tools to identify that small group of people who are at risk. At present, we do that by simply taking a history, performing an echocardiogram, looking at a 24-hour tape. And that model, where we bring together these so-called major risk factors, works reasonably well, but there's still clearly a group that we're missing using that conventional approach. One alternative is to recognize the fact that hypertrophic cardiomyopathy is in fact a group of diseases, some of which are genetic, some of which are acquired. And our hope is that by using tools such as genotyping or novel biomarkers, we can identify these subgroups, define their natural histories, and develop specific tools for predicting outcome in those subtypes of hypertrophic cardiomyopathy.
Why only 24% of patients with heart failure receive warfarin?
So what you're referring to is a data analysis that we've recently performed in the United Kingdom. We are able to interrogate electronic patient records from the entire UK, and we've recently looked at 5 million people and extracted from that 5 million those who we think have hypertrophic cardiomyopathy. This has identified a number of things. It's shown that the death rates from heart failure and sudden cardiac death are still relatively high despite modern guidelines. And in the case of atrial fibrillation, we've shown that maybe somewhere between 15 and 20% of patients in the population are developing AF, but less than a quarter are receiving anticoagulation. Now, at the moment, we don't know the reason for that. We're not sure whether it's because general practitioners or cardiologists are unaware of current guidelines, but it has shown us that there's a significant need for better implementation of practice guidelines in general care.
And do we have limitations in current prognosis factor research, and how to improve it?
So I think in prognosis research in hypertrophic cardiomyopathy, we're always looking for new ways of predicting risk and new variables which might help us do that. At the moment, we don't use genotyping. And that's largely because it's been very expensive, and we haven't had large populations who are genotyped that we can then model in the same way as we have with conventional cardiological markers. But that's now changing, so we're now starting to put together large patient populations who are undergoing targeted sequencing or whole genome sequencing. And our hope is over the next few years we will be able to integrate that information into prognostic models.